Welcome, dear listeners, to Public Health Musings, the podcast that takes you on an inspiring journey through the world of public health, offering insights and ideas that motivate us to create a healthier and happier world. I'm your host, Dr. Caroline Kingori. It's a pleasure to have you with us today. This episode is brought to you by Okera Coffee. Elevate your coffee experiences today with premium freshly roasted beans delivered to your door. Use code SAVE10 for your first order. Treat yourself at shopokeracoffee.com. That's SHOPUKIIRACOFFEE.com. So in today's episode, we have a truly remarkable guest joining us. Mr. RJ Kedziora, the co-founder of Estenda Solutions, is here to share his wealth of knowledge and experience at the intersection of healthcare and technology. He has had an amazing career of over 3 decades, and it's been nothing but extraordinary, if I should say so myself. He holds an MBA from Westchester University and a Bachelor of Science in Computer Sciences from Duquesne University, where he received the Excellence in Computer Science Award. He has not only been a pioneer in developing custom software solutions, but has also contributed significantly to improving patient outcomes through innovative data analysis. His expertise is well sought after. He's presented at conferences. He's well published. And I'm so glad we have him on the show today to talk more about public health technology and innovation. Welcome to the show, RJ.
Thank you very much, Carolyn. I look forward to a conversation.
Yes, so excited. So I always ask my guests to tell me their story. Like, how did you get to this place where you're at? Could you share more about those pivotal moments or experiences that have led you to this journey and how you became this leading figure in intersection and healthcare and technology at Estenda Solutions?
Yeah, I'd love to. As you mentioned, it's been 3 decades, which is always interesting when I can think about decades and not years anymore. So we'll hit some of the highlights. But it really started, I was fortunate when I was in 7th grade. My parents purchased a computer back in the 80s for me. And I did play my fair share of games, don't get me wrong. But I was very intrigued by what I could do with a computer and started programming in grade school, very early on. What could I do with a computer? So that led me to, a college degree in computer science. And then I did have aspirations of a PhD in artificial intelligence back in the early 90s. But then I got that first job offer and I was like, wait a minute, more debt or earn a living and contribute. So I went, and started working professionally and started, of all places, in the steel industry. In Duquesne University is in Pittsburgh, and so one of the major companies there in the area was U.S. Steel. So I started working with them on the tubular manufacturing division, which was interesting. I did railroad car scheduling algorithms, testing algorithms, and then swiftly moved on to other industries. Got into some of the real estate and banking industries, some consulting in healthcare a little bit. In the late 90s, I joined a company that was focused on pharmaceutical consulting. And that's really where the idea of getting into healthcare came about. I had some opportunities with some of the major pharmaceutical companies working on systems in-house that they were developing. And it was like, okay, the accounting systems are interesting. The inventory management systems are interesting. And they're very essential and important. But with healthcare, you're giving back. There's a bigger purpose. And that's then in 2003 started Estenda Solutions with a good friend, Drew Lewis, and we focused on healthcare. And at the very early stages, we're like, okay, what can we do? How can we give back and do this in healthcare? And we got our start with Estenda it was an actual congressional grant for military healthcare. So we developed diabetes disease management solution with folks like the Walter Reed Army Medical Center, Joslin Diabetes Center, and that just really carried us through those early years. And fast forward 20 years later, we're still going strong, developing innovative solutions in the healthcare space every day. So it's been quite the journey in not only just healthcare, but I think one of those other pivotal moments that you think about is understanding people over technology. Technology is incredibly powerful, incredibly capable, but who's using it? And that's made a difference too, to be able to recognize that and early on how are those people using the technology.
I'm glad you brought that up, how are people using technology, because I don't know if it's become a big thing. It's always been there, I know. But there's so much more conversation now. We have all these boot camps, we're looking at those intersections. And so for the lay person, what would we say is the big deal about technology, right? And how do we describe that intersection between technology and healthcare?
It's healthcare has always had technology, but it's very much been more on, as I think about the diagnostic side of figuring out your MRIs, your X-rays, and things of that nature, drug development, where it's now transformed to it's really about data in the healthcare industry. It's in my opinion the last industry to really embrace the idea of data. And if there's one thing that I've seen change in healthcare over the 20 years, it's just been that proliferation of data. There is, it's so much data is available. It's gone from how do we acquire this data to now we have so much, what do we do with it?
And I like that response because it's a segue to my next question. All this proliferation, what is it? Data, is that the only significant change you've seen with regard to changes in healthcare technology? Are there other key technological advancements that you've seen and have had profound impact on the healthcare industry in your perspective?
Yeah, from my perspective, working in technology and data analytics, we do a lot of work in data analytics. It really does focus around data, but in a couple different ways. One, medical record systems. They have been around for decades and decades kind of thing, but only in the late 2000, 2008, 2009, 10 kind of thing, where the government mandate here in the US came around that you must use the medical record systems, that is taken off. And so much from that clinical perspective is now captured in a meaningful fashion. There are lots of challenges still with interoperability and sharing that information between different providers in different health systems, but we're definitely making strides in that, because if that data is just on paper, it's hard to do anything with it. And unfortunately, EMRs have suffered a little bit from usability. They were really designed around the idea of billing and capturing that information for billing, not so much care, but that's also transforming these days. And the second thing in data is wearables. When we got our start 20 years ago with Astenda in diabetes, it was finger stick technology, it was the state-of-the-art technology. And it's not fun taking your blood glucose reading when you have to prick yourself with, and then now there's continuous glucose monitoring devices that are available that can take a reading every 5 minutes. And that information is so powerful. And a key thing, one, the data, but it's also faded somewhat into the background of how to acquire that information. I was fortunate early on to wear some of like the heart rate monitoring devices, but you would have multiple leads with wires connecting to different places. And it was hard to wear. It was hard, all sorts of issues. Where today, you wear a ring or the Apple Watch and you just don't even think about it anymore. And as, we move forward in the future, just there's all sorts of passive technology in the home. So as, society continues to get older and, my parents get older kind of thing, you'd rather have them in the home, an environment they're very used to. And so you can put a sensor on their bed to know they got out of bed in the morning. They don't have to, it's like you don't want to put it there in secret, but it fades into the background. It's just part of daily living life. And then I think the third key technology advancement over the last 20 years or so is AI. AI is growing more and more significantly. What, Gen AI and the chat GPTs are making the most noise of the last year, but AI has been there for a long time. And it's as we're getting all of this data, what do you do with it? How do you analyze it? So if you go to your primary care doctor, you're lucky to have 10, 15 minutes. You can't walk into that doctor with an app and be like, what do I do? Us as the software developers of the world, the technologists of the world, have to be able to provide that information and point out the salient information and provide advice.
Yeah, I think I've appreciated the ease now in whether it's collecting data or finding information quickly. Of course, we have some concerns, and we'll talk about that down the line in this interview. But as you were talking about diabetes, I have a friend now. She wears this monitor on her hand, and she says it's been the best thing ever. It was the first time for me to see that, and I was like, I like that. I like technology because it disrupts. It's ever evolving. It doesn't always stick to the status quo, and that has its, again, pros and cons with that. And it's been really fascinating. The other day I was at the doctor's office, and with women, we have to get the annual breast exam. And I was like, no one has figured out how to do this easy. Like just have something pass over me, around me, like a less expensive MRI, things like that. Yeah.
Someone's working on it. There's someone out there working on it, I'm sure.
RJ, you got to do something,
There you go. Next week, we'll work on that.
Yes, let's get those big grants, and we get you on that path. So we know that with the work that you've done, you've talked about, you got this congressional grant, and public health calls for collaboration across sectors. And so how do you see the intersection of healthcare technology and public health evolving? And what are those strategies or innovations that do you believe would be most crucial for improving overall population health and well-being? Big question.
Yeah, it is a good question. And I think about that again, going back to that primary care visit where you have 10 minutes, if you're lucky, 15 minutes with that physician, and they're probably overwhelmed. And they have a staff to help out of nurses and other healthcare practitioners, but there's a lot going on in that community. And as you go into that visit, you're probably focused on one specific thing. And it gets really challenging for the healthcare team to really understand what's going on with you in life outside of that visit. What are you doing personally? So here in the US, there's an obesity epidemic. There are mental health epidemics, challenges. There's just not enough people to provide the level of care that we really need. And a lot of that is outside of that 10-minute visit. So one of the things that's recently happened, probably last 5 to 7 years kind of thing, is this turning our attention to social determinants of health, of being able to understand and track what is going on outside of that office. What is your physical environment like? Do you have access to healthy food? The concept of a food desert, particularly if you live in inner cities, it might be really difficult to get a banana or an apple or blueberries kind of thing that are better to eat than the candy bar or the Coke, or Pepsi. It's there are better options that are hard to get to. So if we, from that public health perspective, can gain a better perspective on where those challenges are in the environment and develop solutions around those, the better off we'll be. And the second aspect of that, from the intersection of technology and public health, again, how do we address the lack of providers or professionals that can deliver this care? And that's where I think the technology really comes into the play of digital health applications. Smartphones are everywhere these days. It's not 100% just yet. There are still challenges in having access to that technology and understanding how to use the technology, but that is quickly changing and shifting there. And there are privacy concerns, with that level of access and information. So we have to make sure we address those. But if you think of digital health apps, there's 300,000 or so digital health apps. There's a lot of digital health apps out there. Are they any good? Some are, some aren't kind of. There's a newer concept called a digital therapeutic. And I think of it as a difference between vitamins and minerals that you can buy, at the local drugstore. They have some evidence, but they haven't really done the good, rigorous clinical trials to really prove that they have an impact, that they do work. And then you have drugs, which have gone through medications that are prescribed by physicians that have gone through extensive clinical reviews, validation that they do make a difference, and they're prescribed by the doctors. They go through review by the FDA or other global regulatory bodies. And that's the idea of the digital therapeutic. So it's a digital health application that has gone beyond, the regular status. It's evidence-based, it's clinically evaluated to treat or manage, prevent a number of issues. Those things can make the difference. Those applications can scale more easily than people. I was at a conference and someone said, we can't outbirth this problem. We can't just have enough people quickly enough and train them quickly enough. But it's very easy for 100,000 people to download a digital health app.
Yeah, and I've seen a lot of progress with those apps, even in resource limited countries, places again where it's a huge distance to get to the clinic and the hospitals, and someone has to track. For example, if this woman gave birth, and then they want to see how the child is doing, how the mother is doing, to reduce child and maternal mortality. And again, people have more phones than there are people. You think of places like Africa, Asia, South America. Everybody has a phone, and I really appreciated that digital disruption. The other thing I find also, health behavior. We try not to police people's behaviors and tell them what to do, but we do. You have to eat this, you have to exercise, you have to, protect yourself against sexually transmitted infections. And sometimes that goes through one year and goes out through the other year. And I work with young people, young adults, and I found that, yes, we can provide people with all this information, but we need to give them a way for that information to be reiterated, but also give them the opportunity to engage in those behaviors. And, my colleagues and I developed this Choose Your Own Adventure video. And we used that, and I was like, "Woo! I'm getting into the tech." And I'm so fascinated. Won a few awards, and I'm like, "I want to do this." So when I heard I was going to be talking to you, I was like, "Yes, RJ, I will bombard you with all this information."
We're going to have many more conversations after this. That's the beauty of it. It's like, so you don't have a technology background, but you were able to figure out how to address a challenge, a problem, using technology where the people you're trying to help are, so they have access to that smartphone. And a lot of teenagers and young adults say it's it's attached to their hands. There's an opportunity there to be able to make a change. And yes, the idea of behavior change is very complex. Mm-hmm. It's not something you should take lightly. And part of a lot of what we do, we have some PhDs on staff. Because as we develop solutions with our partners and customers, it's one thing to be like, okay, yeah, we think this works. It's another to actually prove it. So those PhDs that we have are able to, create the study protocols, go through the IRB, to get the study protocols approved, and then do the data analysis and research publications. Okay, does this really work, or do we have to change and tweak to make it better?
Exactly, and even speaking about AI, we were able to create a website, and we two pictures that are representative, or we created these pictures, these young people, because we couldn't use the real pictures. And I was like, oh my God, technology, I can't get enough of you right now. Just, I get so excited, so much more. So you brought up the issue of challenges, security, and we know that data security and compliance are critical in healthcare. So tell us more about those challenges and what potential strategies are there in making sure that all this regulatory compliance, and when you're working with technology, healthcare software projects at your company, how do you go about doing that?
Yeah. Do you have like 3 or 4 hours to go through everything?
In a nutshell.
Yeah, I got in a nutshell. Yes, particularly in any industry, but particularly in healthcare, you have to be aware and make sure that the data that you have is secure. HIPAA is definitely in the U.S. world here have to comply. But one of the interesting things I find people don't really realize is even if you're gathering healthcare data and a healthcare provider is not part of that picture, and you're not at a healthcare institution, then you're really not bound by the HIPAA laws, but you are bound by the FTC. So they do have privacy regulations. So it's just because you're not engaged with the healthcare industry doesn't mean you don't have to care about the privacy and security of that data. You still have to care about the privacy and security of the data. So, big challenges are one, time and dollars in terms of developing the solutions to make sure that they are secure. We train our developers from a security perspective. And we have our software development process is certified to an ISO standard called ISO 13485, which in layman's terms basically means we have a good quality management system, a well-structured quality management system. So as we develop software, it's very SOP driven, template driven, checklist driven to make sure as we develop a solution, we consider all of the different things that we need to consider. You might make a decision not to deal with a particular challenge at an early stage of a project, but you've thought about it, and then you're noting that kind of thing. So, okay, we're going to phase 2 of the project, then we're going to engage in taking on that aspect. But there are frameworks out there. There's tons of information out there. There's something called the High Trust Common Security Framework. It goes beyond HIPAA and is a little more prescriptive in what you have to actually do to comply with it. Very checklist driven. And security is a lot about people as well. Just as we talked early on, we started, technology is as much about people. So is security. As if you put the good processes in place, you're going to be better off to be able to do that. And then the last thing I'll mention, without getting too technical, the government has recently, last year, mandated the idea of what's called a software bill of materials. And it's a recipe of what are the components in your software that you've developed, what are the different things that you've used. And you can take that list, and there are services now that'll process that list and track known vulnerabilities. So cybersecurity is somewhat of a race between like the bad actors and the people trying to protect the data. And so it is ever changing. And the idea of that software bill of materials is that you can monitor for ongoing cybersecurity threats over time. And as they surface, you can be notified very quickly and address them. And the government has made that part of their process. And the FDA now even, if you do go to the FDA for approval, they said you need a cybersecurity plan or else we won't even look at your application. So whereas before, it was highly suggested, now it's required. You need to have a cybersecurity plan.
And I think that's really important. Again, you said there are people out there, they're always concerned about people stealing our information. And I know that it's a constant beefing up of the security measures, which does put us in a position of being nervous, but it's the field we're in, right? And so, in addition to the security concerns, I know we've had so many global challenges, right? And you're working hard with your organization to provide solutions. So I don't know if you, particularly in your organization, if there are examples of how extender solutions, custom software, and data analysis have been deployed to address public health crises or support public health initiatives, and what impact have those had on communities? So I work very closely with communities, and all my guests, I always ask, grassroots
Yeah.
level, what are you doing there?
One of our major projects comes to mind right away. As part of that, the initial grant that got us started many years ago with the Joslin Diabetes Center in Boston, developed what's called the Joslin Vision Network. It's a tele-ophthalmology system for detection of diabetic retinopathy. And it's deployed in the Indian Health Services here in the US, which is responsible for the American Indian population. That population is decimated by diabetes. They're severely affected by diabetes. And retinopathy is currently the leading cause of preventable blindness. If you can find it, it can be treated. So we now manage this system with the Joslin Diabetes Center, and it's deployed about 100 sites throughout the United States where you can go in and have your eyes imaged. You don't have to be dilated, so it's very easy to do. Those images are then sent back to a reading center where they're evaluated, and then a report goes back to that community health center or wherever you're receiving treatment to be able to prevent that as we find the disease. So we've been doing that for 20 years now. The American Academy of Ophthalmology actually just this October awarded the program an award achievement for their contribution to it. So that was really nice to see. And it's very much a collaboration with the Indian Health Services. They're the ones running the program, providing the treatment, where we do the technology behind it, support the program. But we talk about why healthcare, and it's that you can see the impact of what we're making, and the difference it makes, and the level of disease and incidence we find, which then equates to the number of people that we can help and can provide treatment. So that's been a valuable experience over the 20 years to be part of that project. It's been great.
Fantastic. And as you were talking, I was thinking of other resource limited areas, especially here in the United States. I live in Ohio. Appalachia is like next door. And we have communities in rural America that don't have access to internet. And we had COVID. We have telemedicine. Has Estenda been involved in any of that telemedicine or ways to reach those kinds of communities? Or what insight do you have to help increase healthcare services from a technological perspective for such communities?
Yeah, we didn't do anything with COVID per se, but a huge part of what we've done for a variety of customers over the last 2 decades is remote home monitoring. And how do we get that data from the home to the clinic? We had for a good 10 plus years, we were running some projects in Hawaii, very rural communities there as well, doing blood pressure monitoring. It's like instead of having to come into the clinic, you can get that data remotely. So again, it's where are you as an individual comfortable? And then, with fast forward to COVID kind of thing, we're all stuck in the house. Again, it's like getting to the doctor is difficult and you might only have 10 minutes, but that data can then be shared with your healthcare professional. So it used to be, when we got started in doing the remote home monitoring, it was these one-off projects. So like, okay, how do we integrate the data from here to there? Now there's a lot of third-party vendors that act as information brokers and go-betweens to get the data. So we'll now work with the companies and the information broker, and we'll make that interchange between them to be able to move the data around. But yeah, it's very much, how do you get it? All goes back to data.
And data is fantastic. As researchers, we love data. We love monitoring that. But we also know that on the ground, things might look different with the communities. And they're like, no, we're not aware of that. We have diabetes here? No. What we have is something else. And I've always wondered, how do we bridge that gap? Because we have all this technology. How do we make sure that we don't take a whole year to find out what the community needs are and then try to match that with what the CDC said? I don't know. How do we disrupt that?
Above my pay grade. It is an interesting challenge. In my mind does, go to technology. Like, how can you use the technology? And you do have to be cautious of invasion of privacy and those types of things. With the use of technology, but I think we have to learn from the marketing industry. You walk into a supermarket now and everything is tracked. It's like you move left and, they from a marketing perspective, when you walk into a supermarket, they know like within the first 15 feet, you're going to usually turn left more than you turn right. Like that is an amazing thing to know. And so you can position products better to the left, to the right. And that products at eyesight are going to sell more than the ones that are lower to the, on the floor. Amazing insight. So how do we, apply those ideas and that technology to then the community? You do absolutely have to be aware of like invasion of privacies and, sort of the overlord watching everything that's going on. But yeah, with technology, we're just going to learn more and more about what happens outside of that visit with individual people in what's going on. It's going to be an interesting time.
Great idea. Now my brain is like, ooh, I'm going to have some discussions about this and see how best to get that information fast and in real time so we can meet those needs better than having to wait for forever.
Yeah, you want to be where the people are at too. Like there's an institute, a government institute called PCORI, Patient-Centered Outcomes Research, that we did some work with years ago, kind of thing. And we teamed up with a woman that was providing healthcare education in the community by going to the churches, because this is where the community was. This is where the people were. That's, they didn't have to go somewhere extra. It was like after services, it's like, okay, here's some educational material kind of thing. So it's like, how do you bring the technology to that? It's like, okay, after this session, we're going to have a discussion about, weight management. Here's an application that you can download and use to better track and see information. Because a lot of it, like I said, there's 300,000 digital health apps, there's probably 100 or so of those digital therapeutics, and that is growing out there. But yeah, it's like, how do you make people just aware of what's possible? Yeah. And they're going to have their smartphones with them.
Yeah. You hit the nail on the head there, because we have all these initiatives, we have all those interventions, and churches have been awesome, helping community organizations, community events, but the process is always slow. And so I like the idea of using that technology that's already there and figuring out, catch them when you have them at that moment and get that information, and then see how it can be utilized to help improve their health outcomes. So fantastic. So now looking to the future and thinking of the disruption or the mess that COVID left behind, what does the future of healthcare technology pause? COVID is not done yet, but
yeah, not done yet.
Not done yet. But the mess that it came with, what does the future of healthcare technology look like from your perspective, and how do you envision your company and other technology companies shaping that evolving landscape?
Yeah, it sometimes it's hard to find a silver lining in COVID, but there is a silver lining there, that it has helped accelerate some of this healthcare technology, particularly the idea of telemedicine. As we're talking about rural healthcare populations and you don't have those experts there, okay, telehealth is a very accessible method to be able to reach out to those professionals. You can do it on your phone. You don't need a computer with internet access, high-speed internet access at home, which is, a lot harder to get. But more and more people have that smartphone, so you can do the telehealth visit. So that's accelerating as well. But the remote home monitoring is accelerating. The idea, I mentioned the idea of the passive technology, so you can age in place at home. There's more and more companies that are dealing, and creating those solutions. And those are the people that we help out there. How do we, gather that information? How do we make sense of that information? So, think of, your mother, father at home. There's a sensor under the bed. Okay, they got out of bed. Ding, there's a piece of information. Can they use the restroom? Ding, second piece of information. They started the coffee machine. They opened the refrigerator. Then going about their daily, habits, nothing's changed. Okay, they got out of bed, but it's like 20 minutes before they got their coffee when it's normally 5. Maybe I should call, kind of thing. So lots of potential, and that's where this, I think, healthcare in the world is going. It's how do we provide these services outside of a doctor's office, of a healthcare setting? How do we do that at home so you can age in place, particularly as the population gets older? In one of those challenges, the data volume's increasing, options increasing, knowledge is increasing, kind of thing. And we humans, I've been posting a lot on LinkedIn about this, but we humans can't keep up.
Yeah.
There's just so much information now that is generated every day. And an often quoted number I hear is that it takes 17 years to get research into routine clinical practice. 17 years. That's like the next generation is coming around before, the routine clinical practice is changing. And that's where AI comes into it. The generative AI, the chat GPTs have generated a lot of noise this year. And I think for good reason. There are absolutely 100% challenges. It's not ready for prime time. And, there's a lot of fear, even in the software development industry. Is AI going to replace the marketing person, the software developer, the doctor? I don't think AI is going to replace any of those professions anytime soon. But the people that use AI are going to be replacing the people that don't. If you're not playing with these tools and technologies today, you're going to fall behind the curve.
Yes. Wow. What a way to finish. No, we don't want to scare people.
There's nothing to be afraid of. It's not, what is this, Schwarzenegger, Terminator, we're nowhere near that
Yeah.
kind of thing. And there are challenges of biases in the data. They're called hallucinations, where these systems make up facts. And what's challenging is it appears like it knows what it's talking about. It appears to be trustworthy. So it's like it'll quote in an article and it's like, oh, sure, great. But then you go and try and find that article and you're like, it doesn't exist. Some lawyers got in trouble for this a while ago because they were using one of these systems to generate arguments in a court case. And it came up with, a court case, but that court case didn't exist. But unless you go and check, it looks legitimate. So you do have to be aware of things like hallucinations. And as we help people develop these systems, particularly in the medical field, it's, okay, what are these generative AIs creating? But then let's do a cross check to make sure that the data is valid against, known good resources, kind of thing. And, if it does make something up, you can throw that reply away and hey, try again. And let's give good factual information to the consumer who's looking for it. It makes a difference. But in all of this, and this is somewhat controversial, but people are biased too. People, your doctor doesn't know everything, and sometimes they're guessing. So again, are we holding AI to a standard that's too high? And that's where it's the AI is not replacing the physician anytime soon, but that AI should be used by a physician as we progress here.
Yes, and that, lets me know that it's important to train people and incorporate diverse perspectives from people with diverse backgrounds, so that they can fact check. But then it goes back to that training. You know, college is where a whole lot of disruption happens. And so we've had our own share of concerns with students. And even as I grade and, give them homework, I have them watch this this podcast as well. And they write a paper or reflection, and I'm like, I can't control, and I won't be there with you, but just make sure that you're using, because I'm going to go check those references and the citations and also the writing. And there's some grammatical issues with ChatGPT sometimes, So I'm like, Grammarly is right there. It's been doing a great job. Utilize that in addition to this, but also be the final soundbite for your own work. And we have a writing center on campus as well and things like that. But I know the speed that this generative AIs produce information is extremely encouraging, but can also be very challenging.
Yes, absolutely. I think of it as an intern. Mm-hmm. So, yes, I can go generate 10 blog article ideas, or I can ask that intern to go generate me 10 blog article ideas.
Right.
And I might not like 5 of them. So create me 5 more.
Right.
Okay. Then, give me 5 more.
Right.
And yeah, the intern is going to go off and do that. ChatGPT and its ilk, Bard, Google's Bard kind of thing, and they do it really fast.
Yeah. Yes. Time is of the essence, but definitely go back and check that information. So thank you so much for joining me today. This was an exciting conversation. I will definitely be bringing you back on because it's always an evolving conversation. And with the way the future is going, there's going to be a lot more conversations about that intersection, of technology and health. But I also want to thank our listeners and, for being there to listen to this insightful conversation that has given us quite a bit on healthcare technology and public health, whether it's software, data analysis, and the importance of focusing on data to inform decision-making processes or improving patient outcomes, and just, the evolving healthcare technology lens and its intersection with public health. So as we continue our journey in exploring the ever-evolving world of public health, let's draw inspiration from today's discussion and strive to contribute to a healthier world through informed action and innovative solutions. So thank you, everyone, particularly RJ, for coming on and being there for this episode. And so stay tuned, everyone, for more engaging conversations that empower us to make a positive impact on the well-being of our communities. And don't forget to subscribe on those platforms that you listen to. So thank you so much, RJ, and wishing you the best as you continue helping us come up with some good solutions to make healthcare more applicable to our communities through health.
Yeah, thank you very much for having me. This is a great conversation.
Fantastic.